Hello everyone, I'm Dr. Salman, and today we'll talk about facelift, the surgical one. A procedure that is very rare. I would say it is the most expensive procedure in the world, everywhere. But at the same time, it is the most rewarding procedure. As we age, we go through a lot of difficulties in life, and then there comes a point when you have achieved a lot, but you have paid for it with the wrinkles and the sagging of your face. Time, it's precious, but at the same time, it's passing day by day. So the surgical facelift is a procedure, it is an art of reversing this time. It can easily take you 10 years back. If you're 70, it can bring you down to 50. In order to understand facelift, we need to understand the anatomy of aging. Every day you get old. Now, in order to understand the anatomy, you need to understand that every year you lose a lot of volume. You lose 1% of bone mass every year. So you're losing bone. You're losing the laxity. Your skin used to be very tight. Now it's getting lax. It's coming down. And third, there is gravity, which is pulling everything down. All these three things, they lead to the signs of aging, which are the smile lines, the jowls, the marionette, the sagging all over, upper eyelid skin, lower eyelid skin, all of this. It's all aging. Now, you see the skin sagging, but then there are certain areas that look deep. For example, the smile line, the jowls. Why? Because there are connections. We call them ligaments. There are connections from the bone to the skin. So everything is sagging, but those ligaments are actually holding up. The ligaments are getting lax, but they're still holding up. This is why you get all the deep wrinkles, which are the main trouble, which is precisely why people want to get rid of them. For fine lines, they would be okay with doing a little bit of Botox. They'll be okay with doing a little bit of laser. They'll be okay with using retinols. But for the deep wrinkles, you always need some sort of a lift. Now, when we talk about the surgical facelift, there are many types, and everything is available online now. You can talk to your ChatGPT. There are patients who come up with the discussions that I've had with ChatGPT, and I'm always impressed. ChatGPT is pretty good. It gives you a reasonably good assessment. Then it gives you which sort of facelift you should go for. The traditional, the smash, the deep plane, the vertical restore. Then patient goes in and they all search about each one. And then they come back to me and tell me, I want this facelift. And mostly it is not based on knowledge of their own skin. It is based on one or two results that they liked the most. And since they were labeled under, for example, deep plane, so they would want to have a deep plane. That's the biggest problem. It's good to search, it's good to be informed, but then you come down to your surgeon and you discuss your problem, and then let the surgeon decide which technique he would want to employ. Yes, he should be well versed in all of them, but there are ways and there are means and there are areas that he would want to focus on that you might not have noticed. There are multiple factors that influence his decision on going with one particular technique in your particular case. Leave that decision to your surgeon. Deep plane is very good. Smash is very good. R-lift, it's very good. Threads, they're very good. MAC, it's very good. Endoscopic, it's very good. All of these are different techniques of facelift. Which one is the best for you? Which one I would recommend and do in your case? That is different. I always love the patients who come in, they have done their homework, They know the different things, but then as far as the surgical plan is concerned, I always guide them on what is the best for them. I would not do deep blend for everyone. I would not do smash for everyone. Every person is different. Every face is different. So get in touch with my managers, book your consultation, and I'll tell you which type of surgical facelift is best for you. Subscribe to my channel for more informative videos.